Okay, so my screen is visible to all of you, Dr. Zaid?
Yes.
Okay. So now we are going to start like how the actually NHS system works, especially related to the training in UK. So I believe to be very much excellent in the tasks related to the structured discussion, especially in the labor ward and the gynae ward. It's really, really important to know about the system in the UK. Okay, so what to expect at the what level of training? Because without knowing that, you wouldn't be able to manage the patient in a safe manner. Okay, as Dr. Zaid explained, you have to know at each level where to escalate for the help. If you are working at the level of ST3, you should have an idea what are your limitations, where you can safely manage the patient, and where you have to ask for the help from your senior colleagues. Okay, so for these reasons, it's really important to know about training in UK. So this is what the specialty training structure and the educational program. Okay, just one moment. Sorry. Okay, so FI1 and FI2 are called as a specialty foundation training, and at the level of ST1 and ST2, we call it as a level of SHO. Okay, so FI1 and FI2 are the foundation training years, and the basic training years are ST1 and ST2, FI2, ST1, and ST2 are the senior house officer levels. At the level of ST2, usually the students can appear in the Part 1 exam, and if they pass the Part 1 exam, they can enter into the training, and the training starts from ST3, 4, 5. And the level of registrar started from ST3 to ST7. So at the end of the ST5, our COG expect the candidate to pass Part 2 MRCOG, then Part 3 MRCOG, and then after that, there would be the level of high specialty training, ST6 and ST7, and we call it as a senior registrar level. Okay, this is a level when the candidate or the student or the trainee is expected to do ATSM, the specialty training in some subspecialty. For example, labor board, for example, gynae, benign gynae, for example, oncology, any of the subspecialty training. So everyone has to complete 2 ATSM to be a consultant in UK. So this chart is freely available on the RCOG website, and even if you could Google, you can find it there. The other important one is this one. This I have found it from the RCOG website. Is a grid matrix of what the expectation of ST1, 2, 3, 4, 5, 6, 7. Like at the level of ST1, the trainee can only observe. They're not expected to perform the procedure. 2, they can perform but under supervision. 3, they can perform under indirect supervision. 4, act independently but with support. 5, entrusted to act independently. Okay, so this one I have taken from the website, and I'm not going to go into the detail. I'm just going to show you all about my about table which I have been prepared. This is a matrix of progression of, it's a 2020 to 2021. This is what Dr. Zaid was talking about. Okay, so ST1, ST2, 3, 4, 5, 6, 7, this is what they are expected to do so. Okay, for example, the ST1, at the level of ST1, they should sign off with the cervical smear OSAT. If the 3 summative OSAT wouldn't be signed, they are not allowed to enter into the training at the level of ST2. Okay, at the level of ST2, they expected to have a sign-off procedure like basic cesarean section, vent-tooth delivery, non-rotational forceps delivery, perineal repair, episiotomy basically, surgical management of miscarriage, endometrial biopsy, insertion of intrauterine system or IUCDs. Without having the 3 summative OSATs related to these procedures, they are not allowed to enter into the ST3 training. So this is what actually the training works in NHS. So it is really important to understand. If you are working at a level of ST3, you can remove the placenta. In case of retention of placenta, you can perform abdominal ultrasound. You can perform the abdominal ultrasound for the early pregnancy or the late pregnancy, but you are not expected to perform the hysteroscopies and the laparoscopies, complex or even the simple laparoscopy. So it is really important to know at what level, what is the expectation, what are the OSATs that need to be signed, because if you in the structure viva task, if you explain the examiner something which is not allowed you to do so, it comes against the patient's safety. Okay, so that's why it's important. Just one moment, I'm going to show you my table as well. So if you all can see, just 1 second. Okay, so at the level of FY1 and FY2, they usually expect to take only history and examination. They can do apologies if the patient has to wait long. They pass the cannula, take the blood, but they are not allowed to take the consent. Okay, everyone? Not allowed to take the consent. SHO level is FY2, ST1, and ST2. So at the level of ST1, they're the first on call. They work, all work of the ST1 is under supervision. They're not allowed to do so anything alone, anything. They can do history examination, they can prescribe the medication, they can do the discharge summaries, all this stuff. They can interpret the CTG, but only the normal CTG. If they think that there is something wrong in the CTG, they are not allowed to comment on that CTG. Okay, but they are not being allowed to take any action on that CTG. They can suture episiotomy, but under the supervision. Okay, so this is what the ST1 can do in the UK. ST2, initially first on call, they more assist in the theater, for example, assist in cesarean section. They can interpret the CTG. They can consent for the cesarean section, but cannot consent for the laparoscopy. What they can do is they can open and close the abdomen, and at the level of ST2, they should be signed off for episiotomy. So they can suture episiotomy without supervision even, but not obstetric internal or external sphincter injuries. Okay. So at the level of ST2, they can assist in theater, cesarean section, can open and close the abdomen, can independently suture episiotomy, can interpret the CTG, can consent for cesarean section, but not laparoscopy. Okay. So ST3, ST4, ST5 are the registrar level. Okay. So ST3 is the first tier of the registrar. They usually present alone on duty in labor ward or even in gynae at night. All regular work or ST3 and ST4 is without supervision. So they must be independently able to manage the labor ward at the gynae ward. So at the end of the ST3 training, they should be signed off for the cesarean, like basic cesarean section. What is a basic cesarean section? For example, primary gravida cesarean section and previous one cesarean section. Non-rotational forceps or induced delivery, fetal scalp sampling, surgical management of miscarriage. Okay. They should be signed off with all these procedures. Otherwise, they wouldn't be allowed to enter into the ST4 training. Okay. The ST4, at the level of ST4, they should be competent or should learn or should have an OSI being signed off for basic ultrasound, trans-abdominal ultrasound, at 8 to 12 week late pregnancy ultrasound, and they should be able to perform the manual removal of placenta. Okay. So at the level of ST5, they should be signed off for hysteroscopies, diagnostic laparoscopies, third-degree perineal tears, surgical management of RPUCs after 16 weeks of gestation using suction curettage or surgical curettage. Okay, so this is if they are competent to, like at the end of their ST5, they should be competent to perform all these procedures. Okay, so in the labor ward, if they will say you are working as an ST5, and if you found some procedure who need hysteroscopy, some procedures who need laparoscopy, third degree repair, you can say that I will do that. Okay, because I'm being signed off, so I will do that. ST5 and ST6 can do without supervision if 3 summative OSATs of these procedures being signed off, like simple operative hysteroscopies, laparoscopic sterilization, simple adnexal surgeries, adheolysis, ovarian drilling, cesarean section intermediate, rotational deliveries particularly. Okay, because when they would be able to do these procedures, when their T3 summative OSATs would be signed off, they can work like as a senior registrar in any of the hospital in NHS. Okay, so this is what the competencies of senior registrars is. So ST5 cannot do that unless their OSATs become signed off. ST6 and ST7 at the senior registrar level. So consultant, what is the job of the consultant? The consultant should do complex cesarean section, for example, placenta previa, accarita, increta, previous forced cesarean section, previous history of rupture, laparoscopic management of ectopic pregnancy. Senior registrar are not going to do that. Ovarian cystectomy, if there is ovarian torsion, then ovarian cystectomy and oophorectomies. Surgical management of PPH, control PPH, including intrauterine balloons, brace sutures, uterine packing, and hysterectomy. Although as I'm working in NHS, we usually do. I'm working at the level of ST4-5, so I can place the balloon and the brace sutures as well. But actually, this is the job of the consultant to do that. But the consultant is always there to supervise me. Okay, so what are the questions here? Let's see in the chat box. Thanks. Okay.
I have
ST2 can
answered all
take.
questions. You can carry on.
Okay.
I was answering.
Okay, so NSAT is usually in the post-op ward. So, you know what, like in the labor ward, there would be team at the time of the handover. So, anesthetic would be there at the time of labor ward handover, midwives, community midwives, and ST5, ST3 formation, they all would be present at the time of the handover. So, the job of anesthetist is to look after the post-operative patients, particularly the patient with the preeclampsia, and help in the process of resuscitation. So, you should have an idea what is the job of anesthetist to do so. Okay. Once you will go into the room and take the consent, the anesthetic will go to the room separately and explain the patient each and everything related to anesthesia and the spinal or the general anesthesia, and like any history related to the anesthesia is going to do. This job is basically going to be done by the anesthetist. Midwife, the coordinative, there are two types of the midwife you can see, basically three types. Coordinating midwife is the one who is going to coordinate with you. Okay. You have to tell everything to the midwife. Okay, do this in this room, you have to do this. In this room, you have to do this. This is the job of the coordinating midwife to give the task to the junior midwife. Okay. And the senior midwife can be there with the coordinating midwife to help. There would be student midwife who can just pass the cannula and do blood. Okay. So they can insert cannula, they can interpret CTG, but definitely they cannot take action. They can escalate for the help because they're very much experienced in interpreting the CTG. And they can suture episiotomy without supervision, depends upon either their OSATs are being signed off or not. So this is only related to the ops. In my last paid session, I have covered the gynae board in which I have explained my students everything, like in terms of the gynae, what is expected at what level of the training to be competent on doing that procedure. So this is only related to the ops. Okay, so any questions related to the training in NHS? Any questions? Any questions, sir?
I think you have explained almost.
Hello, Dr. Alina.
Yes, Asya is there, right?
Dr. Alina, can I ask one this?
Yeah, please.
Consent to be taken by ST2. This is the one you said? Consent will be taken by
Yes.
ST2?
Yes.
ST2 can take only the consent for the cesarean section. Not laparoscopy or hysterectomies.
Okay.
Okay?
But not ST1.
Laparoscopy and hysterectomy. No, not ST1. ST2.
Okay, thank you.
Okay, thank you, Asya. And
hello.
Yes.
Yeah, sorry to disturb you. I want to ask
No,
that
it's okay.
mostly in the labor ward they are providing us ST1. So sometimes there is pathological CTG, and so who will take the consent? Only me. I am the one who is senior there. Then as ST5. And ST1 cannot be.
If there is a pathological CTG, see, there is no hard and fast rule that ST1 and ST2 cannot take the consent. The only point is only who, someone who has a better understanding about the procedure, risk, benefit, and the complication can take the consent. If you think that the ST1 has a knowledge, like if you can explain, sometimes what we do is here we have a GP trainees as well in NHS, and they don't know anything about cesarean section. So first we explain them that on the consent you have to explain about the patient this, and then you can take the consent, and then they can take the consent.
Exactly.
Okay, they can take the consent, but you have to guide them.
Oh, okay. Okay, thank you.
Under your guidance, they can. There is no hard and fast rule they cannot take. ST2 is a much better level because they are going to step up towards ST3. They're going to be registrars too. So they can, and the training, we have to train them in such a manner that they would be able to do everything in the labor ward and the gynae ward. So that's why I have mentioned that they can take the consent. But ST1, if they're going to step up to ST2 too soon, their competency, ST1 competency being signed off, if they're knowledgeable, then definitely they can take the consent. And otherwise, you have to explain ST1 that how to take the consent, what risk benefits, what complications, you have to explain to the patient. Then she can take the consent, okay?
Yeah, sure.
Okay, anything else? Okay, so
another. Hello, Dr.
Yes?
Elena.
Yes,
okay, thanks for the presentation. Yeah, please, for ST2, you said they can interpret CTG and take action. Can they take action?
Sorry, your voice is not clear. Can you please speak a little bit loud? for me?
Okay. What I'm saying is
Yeah.
that for ST2,
ST2. Mm-hmm.
yes, can they take action on CTG after interpretation?
They
they
can
take-
escalate. Yeah, what action? Like, for example, if they think that the CTG is not normal, they have to escalate towards the registrar. They're not going to take any action. They're not going to shift the patient to the theater. They have to escalate to the registrar. Every decision, every important decision should be made at the level of registrar or senior registrar or the consultant level, not at the level of SHO.
Okay. Thank you.
Okay.
Ma'am. Thank you so much.
Okay. So this is what about the system of NHS, the specialty training, what is expected at what level of the at what level of their training. So definitely, inshallah, in our course, we are going to practice all these either in the form of labor board, either in the form of the gynae board. We will practice some sort of the things in the as a structure viva as well. So then you people will master in that board. So you will have an idea like at what level of the training, what is expected from them to do so, what is the formative set, what is the summative set, how it needs to be signed off. If not signed off, what would be happen? Because these all things can come under the module of teaching. Okay. So now it's time for the task. Okay, so I have one volunteer already. Asia,